Dr. Chris here at the Nerve Health Institute. This is another one of our tests that we do on the first visit, and we can do throughout the course of working with patients. But we always talk about oxygen, water, and light being the three primary ingredients in a cell. And so water is so important in our bodies, and we want people to be over 60%, at least 60% water in their bodies. And there's a whole other component to water. We want the water to be healthy and energized in your body and not dead. This test gives us an exact measurement of water. In addition to other things, it'll show us to the decimal point how many pounds of water are in your body. So it's done very, very easy. Now keep in mind, this is for demonstration purposes. Normally you're gonna have minimal clothing on in this test. It's in a private room, and basically one of our staff members comes in, guides the patient through. She would stand up on this here and put her hands on the little devices here, and literally through minutes it'll go through a full scan. You can hear the prompt happening. It'll go through the entire scan of getting her done and getting her fully assessed, and you can come on and step off. You don't feel anything for this test at all. It's very comforting. There are some contraindications with some of our testing, like if you have a pacemaker or electronic device implanted, we don't do this particular device. But it's wonderful for giving a very, very detailed report that'll be just printed in minutes. And so it'll say, like in this patient, for instance, there's 62.6 pounds of water out of 132.9 pounds. So we can actually measure the exact percentage, and we usually do this, we just didn't write it on this, but we normally write the percentage of water in this patient coming through. We also tell our patients it's so important to make sure that your skeletal muscle mass, which is your bones and your muscles, we want that to weigh more than your fat mass. So a lot of times people come to us at a low weight, but yet we want the skeletal muscle, in this patient's case, it was 46.7 pounds of skeletal muscle mass, but she had 47.1 pounds of fat. And so we want this number to decrease. And we have ways of helping patients to target these things and get these over time. This is not a magic wand thing, but we have devices here that will help you get from A to B quicker in terms of building muscle and decreasing fat. Another thing that it gives us, another measuring variable here, is visceral fat, and that's the fat interiorly around your organs. So this is not a pound reference, but it's a numerical reference, and we always want this to be less than 100. So the more this number increases, gets higher than 100, the more fat you have around your organs, and the harder it is for your organs to stay connected to your brain and function properly. So it's a wonderful test here. It does a lot more diagnostics. Literally, it'll go through, tell you exactly how much fat mass is in each arm, in each leg, in your trunk. It goes through all these different parameters, so you can see every part of your body in terms of like your fat mass, your water mass, and what's actually going on. It also goes through your basal metabolic rate, and you can do a QR code here. Patients can just scan it in, and it'll give descriptions of all the different things it's looking for.